museum or the park. It just doesn't make any sense to them. And while we can talk about good germs and bad germs, it doesn't seem to solve the problem. What does solve the problem, though, is just reassuring them how much their parents and grandparents love them and how much we are convinced that we will get through this and that we'll continue to be a wonderful family in the future. I am convinced, beyond a shadow of a doubt, that the Med Center will get through this and come through it with flying colors, and that we'll continue to learn from these experiences, but at the same time, become an even closer, tighter family, supporting the communities that we serve here in Nebraska, across the country, and around the world. I very much look forward to this session tonight because we can all use the benefit of more focus on wellness and resiliency to understand what the stresses are among and between the loved ones who care for those in our system, who teach our students and do the research in our organization. So with that, I want to turn it over to Dr. Linder for some opening remarks. And then I very much look forward to taking any questions that may come up as we go along, and most importantly, to learn from our colleagues. Thanks so much for doing this. It's really very important, and I'm very pleased to be part of it.
Thank you very much, Chancellor Gold. I'm pleased to be with all of you tonight. And whether the family member is a son or daughter working at Nebraska Medicine, whether you are the spouse, significant other, parent, or other relative, I'd say you have a lot to be proud of. Between UNMC and Nebraska Medicine, we have 12,000 colleagues that are delivering on the promise of serious medicine and extraordinary care. And it's safe to say that there's few organizations in the world that have more experience on this issue than we do. We began this journey in 2004, and through that, we navigated the Ebola crisis. We've trained thousands of federal employees and other healthcare workers on how to manage serious infectious diseases. And that really would not be possible without the work of your family members. So we organized this forum tonight to answer questions that you might have. And we will start off, I believe, by Dr. Mark Rupp, who's the Chief of Infectious Disease, who will talk about a pandemic overview. And after Dr. Rupp provides some context of what we're dealing with, we'll open up for questions and answers. And following that, we'll have several speakers addressing the emotional side of what we're all dealing with. So, Dr. Rupp.
Thank you very much, Dr. Linder, and thank you, Dr. Gold, for giving me this opportunity to talk to our extended Nebraska Medicine and UNMC family. I thought that I would begin by just giving a real brief overview of the virus and the pandemic, because I know there's a lot of folks who, don't have an extensive background in biology. So coronaviruses are a family of viruses that we've really known about for decades. They cause about 10 to 20% of common colds that all of us experience almost on a yearly basis. Now, the coronavirus that's causing this epidemic that we've called COVID-19 emerged from China in late 2019 and probably had a reservoir in the bat population in China, and then got a foothold into humans in a food market in Wuhan, China. And from there has spread very, very rapidly throughout the world. As you can see on this map, we're at about 2.5 million cases throughout the world, 175,000 deaths throughout the world. You can see the map of the United States where it really is very, very widespread, and particularly in some of the hot spots on the East Coast, in Chicago and Detroit, a few of our major cities on the West Coast. On the Nebraska map, if you'll move to that next slide, Paul, you'll see that although we certainly don't have the number of cases that have been seen in some areas of the country, we're now up to 1,648 cases, 33 deaths. We're having major outbreaks, as you can see, in the middle part of the state, centered around some of the meatpacking plants in Grand Island and Hastings, and some around Sioux City. We've also had outbreaks in various nursing homes throughout the state. In Douglas County, we're doing a pretty good job in containing this virus through the social distancing measures that everybody is so familiar with and that are so important. And we're up to 305 cases with 14 deaths. And I believe we had 11 new cases yesterday from this epidemic. Now, we know a lot about this virus, and it transmits an awful lot like influenza. And so all of you are familiar with the epidemics that we have with flu every year. It's spread largely by what we call large respiratory droplets. So when people cough or sneeze or talk, they make droplets that go out about 5 or 6 feet from them. And if you come into that range and breathe in those droplets, or those droplets come into contact with your eyes or your nose, you can get infected. Now, in addition, those droplets will settle down over surfaces, and they will remain viable or alive on those surfaces for sometimes hours or even maybe days. And if you touch one of those surfaces and get the virus on your hands, and then you touch your face, you touch your eyes, your nose, your mouth, that virus can then get inoculated and start the infection that way. Now, this virus doesn't cross intact skin, so just simply getting it on your hands and touching something isn't going to result in an infection. It has to be inoculated, and that's why hand hygiene is so important, and that's why we are teaching people to not touch their face. Now, in addition, sometimes in the hospital, we have what we call aerosol generating procedures, where we may be looking in somebody's mouth or doing a bronchoscopy or something along those lines, and that can cause an aerosol generation and maybe some spread via aerosol. Now, clinically, this disease, for the most part, about 80% of the time, is fairly mild. People don't generally have to come into the hospital or maybe even seek medical attention, and they have fevers and cough at home. It's very much somewhat like a flu-like illness, just like we've talked about. Now, in a certain smaller number of people, particularly those who are older in age, or those who have underlying immunosuppressive disorders or problems with their heart or lungs, they can get very sick, and they may need to come in the hospital, and they might even die from this infection. The death rate, we think, is somewhere less than 1%, and probably when everything is all said and done, it may be even less than half of 1%. Now, to compare this to influenza, in which there's probably less than 1 death in 1,000. And that's why we take such special precautions with this, because even though it spreads a lot like flu, and in many people looks a lot like flu, it is a more serious infection and results in death in probably less than 1%. Now, we've taken very, very stringent precautions throughout society, and certainly here at Nebraska Medicine, to try to decrease the spread of this infection. And again, many of you are very familiar with the social distancing recommendations that have been put into place. Don't touch your face, clean surfaces, and wash your hands. Now, here in the hospital, we've taken even more stringent measures to try to protect our healthcare providers and to provide a safe work environment. So these include administrative changes. So this is just simply changing the way that we do our jobs so that we can avoid contact with this virus. So many of you are staying at home, working from home. That obviously removes you from being at risk. We've done things where we've decreased the number of healthcare providers that have to come into contact with a patient. We screen patients very, very aggressively, trying to identify those who might have this disease, and then make sure that we put them into the right precautions to prevent the spread. And we've decreased the number of visitors that come into Nebraska Medicine now, so that again, we're administratively trying to decrease the risk for our providers. Now, engineering precautions are also important, and we've put a lot of those into effect. So putting barriers between patients and healthcare providers, simply plexiglass barriers in some of our clinic areas where we're screening patients. We've devoted entire units to taking care of COVID patients, in which we've changed them to a negative pressure air isolation, so that all the air is being under negative pressure sucked back into a patient's room and then exhausted outdoors or passed through a HEPA filter, so that we further decrease the risk to providers. And then we also provide EVS cleaning of those surfaces, because those are important. As I already mentioned to you, you can pick up the virus from surfaces, and we try to make sure that we're using the right disinfectants and cleaning things very carefully. And then we provide our healthcare providers what we call PPE, or personal protective equipment. These are the masks, the gloves, the gowns, the N95 respirators, and what we call PAPRs, or powered air purifying respirators. Now, when used appropriately, all these measures will very, very much decrease risk and will make the workplace very safe. Now, we have had about 25 or less than 30 healthcare providers that have contracted COVID-19. And when we've looked at them carefully, all but 2 of them have actually had their disease acquired, most likely outside the hospital. They've come into contact with other family members or people who've been sick, or they've recently traveled. And so again, we have a very good track record of providing a very good and safe environment for our healthcare providers. Now, the focus of what we're talking about this evening is really, how do we keep our family safe as well? And I think that what I would emphasize in this regard is that what you do at work is probably the most important thing that you can do to protect your family. And if you're being careful and you're using the personal protective equipment as we've provided, this is a very safe work environment. And that's the most important thing that you can do to avoid getting sick and to avoid taking this virus home to your family. Now, in addition, we should all continue to decrease the risk, as we have done in the community, with social distancing and hand hygiene and wearing of masks now out in the community. But I would emphasize that there's really, very little need for extraordinary measures that I've heard of some of our providers taking and putting into place. You don't need to shower before you go home. This disease, again, is not spread on your skin or on your clothing. You don't need to spray yourself with a disinfectant before you go home. There's no need to really change clothes out in the garage like I hear some people doing, and you can do your laundry in a normal way. Now, when I go home from work, one of the first things I do is, change out of my work clothes and change into my play clothes. And, I'd kind of suggest that you do the same, but you don't need to do that out in the garage and take these extraordinary precautions that, again, I've heard that some people are trying to do. Now, what I'd like to end with is really, I guess, my own philosophical bent about, why are we here? Why are we all in the healthcare profession? And this is a profession, it is a calling, and we're here. And I think most of us went into this because we do have that calling and we want to help others. And that, providing care is a calculated risk. Now, as I've already enumerated, we've done everything we can to prevent that risk and minimize that risk, but it will continue and always will be a calculated risk as we care for our patients. But, we can't let our anxiety and our fear prevent us from our mission. And we will continue to deliver compassionate care to our neighbors, to our friends, to our community, and that's why we're here. And I'd like to end with a quote that one of my colleagues passed on to me, actually attributed to Winston Churchill, that said, "Fear is a reaction. Courage is a decision." And I think we all need to make that decision to be brave. So thank you very much for my time on the program. And I'll be thinking, I believe I have some time now for questions. Is that right, Paul?
We do indeed. And we've got a few lined up here that were submitted ahead of time. And I know a few have been coming in that we're on top of as well. So I'm going to start with this one. And it's a question on a lot of people's mind. When do we expect a peak here in Omaha of COVID cases?
Yeah, that is a good question, Paul, and nobody knows the real answer to that, but most of the models are suggesting that we'll peak here at the end of the month or maybe the first few days of May. It's a little bit, up in the air based upon what we're seeing out in central Nebraska. If those localized outbreaks spread wider through the state, then we may peak later. But again, most people are thinking that we'll peak here later this month or early in May.
And a follow-up to that, somebody just asked how we're doing in Council Bluffs. Is there a big difference across the river from Omaha, or is it we're still all in the same boat, sort of?
No, there's not a big difference in Iowa. They have had more cases than Nebraska, but they are a more populous state. They are seeing some of the same type of phenomenon that we're seeing here in Nebraska, with meat packing plants being particularly hard hit. And so they're having to face some of these same challenges that we are in Nebraska.
Next question that was submitted ahead of time, and you touched on this a bit in your presentation, but any extra steps healthcare workers should be taking to protect their families?
Well, again, I think that, if people are practicing safe care here in the hospital, that's the most important thing that they can be doing to care for their families. And then obviously the things that are important for all of us as we try to stem this outbreak, as far as social distancing, wearing a mask when we're out in public and we can't have that social distancing, washing our hands, getting out of the habit of touching our face, which is actually fairly difficult to do. All of these are things that should be done in the family setting to keep people safe.
And that's a great segue to our next submitted question, which is, should people be wearing masks when they're out in public? What are the benefits?
Yeah, this is a recommended measure. And what people have to understand is that wearing a mask does give them some modest bit of protection from breathing in those droplets. But one of the major impacts of this is probably actually keeping people from spreading the virus to others. So we know that there's a small but important proportion of infections that are actually transmitted before somebody starts to feel sick. And so it's possible that in that day or so before you get sick, you might be shedding the virus in your respiratory secretions. But if you're wearing a mask, you're actually going to be catching those secretions and not spreading them to others. So it's really part of our social contract that we're doing with everybody and trying to prevent the spread of this virus. We certainly do that here in the hospital. So all healthcare providers now for several weeks have been wearing masks. And more recently, we've introduced those for all of our patients, both inpatient and outpatient, for exactly this same reason. We're trying to protect our healthcare providers, and we're trying to protect our patients and our coworkers.
And in the civilian environment, for lack of a better word, the cloth mask is effective if you're going shopping or doing something outside of the house if you have to leave?
That's correct, Paul. So we've got the manufactured approved procedure masks or surgical masks that we're using with our healthcare providers and in our clinical situations. But at home, people should be using a cloth mask. There's instructions on the web and various places from the CDC about how people can go about either making those at home, and certainly you can order these things online now. Again, they offer some protection both for the wearer and for the people around that person who's wearing the mask.
As expected, a number of testing related questions. So in general, what does testing look like for us here right now? And how close are we to a quick turnaround test? We hear about that on the news a lot.
So this virus really, particularly in the initial stages of infection, is in the naso and oral pharynx. And so when we test people, we take a swab and we put it into the nose and we get some of the secretions and the cells from the nasopharynx. And then we extract the RNA from the virus and amplify that through molecular means to find out if the virus is in those secretions. Now, there are other ways of doing the test. And as the infection progresses, it can involve the lower respiratory tract. And therefore, in people who are in the hospital, sometimes we'll send samples from the lower respiratory tract. This would be a sputum or a bronchoscopy specimen. And so those are the things that we test in hospitalized patients. There are some other methods of doing more rapid testing, again, based upon molecular means. And some of those kits are starting to be introduced. Some of them are actually in smaller hospitals in Nebraska that we've distributed from Nebraska Medicine and from our public health lab. So there are some different ways of looking for the virus. And then people are very interested in the blood tests for this virus as well, what we call serology. And so this is looking for antibodies that are directed against the virus and show evidence potentially of immunity. So those are just coming online now. We're doing some testing of those in our lab. We think that we'll be able to offer that test hopefully here by the end of the month. Those are going to be very important, particularly as we're talking about opening up society trying to find out how much penetration this virus has had into our society and how many people are potentially immune. So those are just a few of the things about testing.
And somebody had just asked about the antibody testing. So, the other thing we hear a lot about from testing is treatment. People know there's a clinical trial that UNMC, Nebraska Medicine, is involved with. Dr. Rupp, Dr. Gold, Dr. Linder, anything we can share about the progress of that clinical trial and when there may be results to share?
Sure, I'll be happy to share some information, Paul. So we're very proud of the role that we've played here at Nebraska Medicine. We were actually the first hospital and university to come online with an NIH-sponsored trial. This is being led by Dr. Andre Khalil, one of our infectious disease faculty members. This is testing a new drug called remdesivir. This is a drug that inhibits the virus from being able to replicate. And we're very optimistic that this trial is going to bear fruit and show that this may be a potential way to treat this infection. The study has actually been so successful that it's closed to enrollment now, and hopefully within the next few weeks we'll start to get some statistical analysis and really find out if this is a useful agent. Now, what's so important about this trial is that it is very, very carefully designed, and it will give us really an answer to this question. What many people may have seen is various kinds of preliminary information that comes out with one drug or another where there's no control group. There's no ability to compare it to how somebody would have done without the medication. And so this is a very, very important trial that we're doing here, and really is setting the bar for how studies should be done during an epidemic. We're very, very pleased with the role that we're playing with this. Now, there are a number of other medicines that are also being tested. Hydroxychloroquine is one of those medicines. I'm personally not as enthusiastic about that medicine for a variety of reasons. One is that it's not really been shown to work in other viral infections, and two is that it can have some serious toxicity. So we're less enthusiastic about that. And then there's a whole bunch of other different experimental drugs that are in testing in various types of settings. And again, I'm hopeful that, through our social distancing measures, we'll be able to buy time to do these studies, to find out what can be used to treat patients, and then hopefully buy enough time to create a vaccine.
I think that's a very important point. I think we'll have effective treatments for infection before we'll have a vaccine. And the value of an effective treatment is it will lower the mortality rate, keep some people out of the hospital, or allow them to leave sooner.
It's also true that some of the treatments may also act as a short-acting vaccine-like. That is, some of these monoclonal antibodies that are being developed may have durations as long as a month from a single dose of treatment. And so it could be used potentially for healthcare professionals who are at risk for high exposure. And all of that is moving at a pretty rapid pace with some, I would imagine, preliminary findings as early as the early months of the summer. So we need to keep our fingers crossed because the vaccine is going to be a good deal later.
The bottom line with all of it, though, is that there needs to be careful study and evaluation of everything. So we're not going to see something in the very near future in a matter of weeks, correct?
I'd say, Paul, the single most important thing to me is that the science needs to drive this. It can't be driven by anecdotal experiences. It can't even be driven by best hunches. Anecdotal experience and a mature clinician's hunch can certainly inspire a study, which can then use the science and test the hypothesis. But any conclusion, particularly for the treatment or the prevention of this disease for what would be tens of millions, if not hundreds of millions of Americans and many more worldwide, needs to be solidly based on the science.
What have we been seeing in terms of length of hospital stay for people who have COVID-19 infections in general?
Yeah, Paul, unfortunately, when people get sick enough to come into the hospital, particularly those who are in the ICU, and even more so those who become in need of mechanical ventilation, do have a long course ahead of them. And oftentimes these patients spend weeks in the hospital. That's one of the main differences between this and sometimes the comparator influenza. When people get seriously ill with COVID-19, they can stay in the hospital for a long time.
I wanted to go back to some of our submitted questions, and this is another one that's on a lot of people's minds, and it's kind of a two-parter. How will we know when it's safe to reopen, and is our organization being consulted by state leaders on this question?
Dr. Gold, maybe I'll defer the last part of that question to you, because I know that certainly you've been involved with the Governor's Council and others.
Sure. Well, we've been working very closely, not only with the Governor's Office and the State Department of Health and Human Services, but we've also been working very closely on the federal level with the CDC and with the Department of Health and Human Services, and actually with the Department of Defense as well. As many of this audience probably know, the leadership of the Med Center here is highly respected, going back to the early days of biocontainment, the care of Ebola patients, now 6 years ago or so, and most recently with the repatriation of American citizens from Wuhan, from the Diamond Princess, and several other cohorts that we've had the privilege of caring for. So we do a number of things for the governor and for the Department of Health and Human Services, the public health organizations, the mayor, the county leaders across the state. We provide judgment. We help analyze data. We help interpret clinical trials and other important pieces of information. But at the end of the day, the governor's office, the Department of Health, et cetera, really reach their own decisions. And they base that on a number of different factors that go far beyond the issues of the spread of disease, how much utilization occurs of our healthcare facilities, and other such things. But I am very pleased that the Med Center team does have the ear of the governor. We speak frequently. I know he listens carefully, but he listens to many different people and reaches decisions that he thinks are in the best interest of the state.
So a related question on state public policy. We've had a few people ask about the recent announcement from the governor's office about elective surgeries and other such procedures being allowed to resume on May 4th. People want to know what Nebraska Medicine's plans are in that area.
Well, I'll start off with that. We've actually been thinking about that prior to the governor making his announcement. I think in terms of metaphors, it's not going to be switching a light on. It's going to be gradually resuming certain activities for the individuals who are most in need of that care. And we would be balancing the resumption of those activities based on our facilities that are available, on the availability of PPE, on the availability of workforce. So we will be beginning to resume those type of procedures, but carefully monitoring the rate that we do it, just so we are able to take care of any surges, and also that we properly resume those activities.
Yeah, so we've talked a lot with the governor's office and on the federal level as well about this. You know, I think the balanced approach, Jim, is going to be the key approach here. Certainly, it's going to depend somewhat on what we're seeing in the community. So, for instance, I would say that if the current trends remain, Omaha is going to be able to reopen elective surgery and procedures a lot sooner than Hastings or Lexington or Grand Island, just because they're seeing a tremendous surge in positive tests. And we know when the tests are positive, you're going to see surges in hospital utilization and outpatient care in the next several weeks. And you really want to be able to protect the capacity of our healthcare system for those who may need it, particularly the most vulnerable, meaning the older population and those with the comorbidities that Dr. Rupp outlined so carefully. So I agree, it's not going to be like flicking a switch. I think it also is going to depend somewhat about how much of our resources at any given time in an intensive care unit or utilization of ventilators might be tied up with taking care of COVID patients. You know, even though we might have, 100 empty hospital beds, that might be very good for ambulatory outpatient procedures, but it might not be so great for inpatient procedures if most of our ventilators are tied up at that time. And so I think it's going to vary widely across the state. And I think we're just going to have to see when the day comes, what changes on a day-to-day basis, and then make reasonable decisions.
We have at least a dozen of our experienced clinical colleagues actively working on this, and we have a lot of data inputs. So it's a topic of active discussion, and I'm confident we'll do it in a balanced way. Uh, as you alluded to, Chancellor Gold, a lot of this depends on the number of positive cases that are in the community. And if we see those trending downward, we can feel confident that we won't have a surge. So good, accurate testing is essential to making these decisions.
So Paul, I'll just hop in as well. You know, we didn't answer the first part of that question, the last one with regard to, you know, when are we going to open up society? And I think that some of those considerations are exactly what Doctors Gold and Linder just outlined with regard to when we can safely resume surgery. It's very similar to when we can start to open up society. And I guess what I would point out to the audience is that this is a very complex and high stakes question that nobody really knows the answer on. And I can guarantee you that our public health officials and our government officials are approaching this with the best interest of Nebraskans at heart. And they're really trying to do the best job they can in a situation where we don't have, you know, complete data. So clearly, if we open up too quickly, the epidemic has the risk of coming roaring back. But, you know, there's also very much damage that's being done by having a closed society. So businesses are suffering, the economy is suffering, people are isolated, and we're going to talk a little bit more about that later in the conversation this evening of how people can maintain their mental health and their spirits. But all of these have, you know, really profound effects and have to be balanced as we make that decision. Again, as has already been pointed out, we need to be on the downside of the pandemic curve. We need to have enough capacity within our hospital system to continue to care for COVID patients. We need to be able to test people and quickly get them into quarantine if we identify those cases. And public health needs to be able to do contact tracing. So when we have those things in place, then it becomes much safer to start to relax some of the precautions and get our economy rolling again and get society rolling again. Again, it's a tough question, and people are doing the very best that they can with this.
So when we do these forums for our staff, I sort of enter a period of, say, it's the lightning round. So we have some technical questions here, and about 5 minutes left before Dr. Cates and Dr. Richards share their information. So a few technical questions, Dr. Rupp. First of all, should a healthcare provider cover their hair when they're caring for a COVID patient?
You know, we recommend that people wear eye protection and face protection to make sure that the virus doesn't get onto the mucous membranes. There really is no information to suggest that people carry this on their hair or on their skin or some other place and that it poses a danger. So if folks are wearing the appropriate PPE with face protection, eye protection, respiratory protection, gown and gloves, they should really be in very good shape.
What recommendations do you have for a family expecting a baby in the next several weeks?
Well, we do have very careful recommendations for expectant moms. Clearly, they want to be in a quarantine situation in the couple of weeks before they deliver. That's not because COVID-19 is that much of a dangerous infection for moms, but we want to make sure that that baby is protected, that the mother is not infected when she goes into labor, and that the baby and the mother are able to join together and bond right after delivery. Because if the mother is infected, right now the recommendations are that the mother and the child are separated until the mother recovers from the illness. So we want to make sure that that doesn't happen. So again, the recommendations for anybody at home who's pregnant and coming up on delivery would be stay at home, practice those social distancing things very, very stringently, and make sure that as you go into labor that you're healthy.
Does the virus live on grocery store shelves and products there?
Well, again, as I mentioned earlier, you know, if somebody does contaminate a surface with a respiratory secretion through a cough or a sneeze, the virus can live on surfaces, sometimes for hours or maybe even for a few days. But it very quickly dies off when it's dried or subjected to sunlight. And there really just isn't any indication that people are getting infected, you know, again, by their food items at the store or something along those lines. But it does give another reason why it's good to practice hand hygiene and to be careful not to touch your face.
Do we have any additional information about the role of the weather? There was some hope early on that summer months would lead to a downward trend. Do we know anything more about that?
Well, we really don't, but you know, I'm guardedly optimistic that the weather and the humidity will work in our favor. We clearly know that respiratory viruses, including coronaviruses, don't spread very well during the summer months. I think it can only but help us as we get into the warmer, more humid months. So I'm guardedly optimistic that this is going to work in our favor, but I certainly don't know that.
Have we consulted with the World Health Organization? We've certainly consulted with our local and regional and national leaders, but how is that consultation extended globally?
Well, we certainly take into account recommendations from the World Health Organization, from the CDC, from other agencies as we go about formulating, you know, our guidance for the public and for our healthcare providers. Dr. Golden, maybe you again would have better insight on that than I do.
Sure. Well, among many other things, the Dean of our College of Public Health, Ali Khan, sits on the GOARN board, which is one of the global boards that looks at the spread of infectious diseases worldwide. But yeah, you know, we're constantly reading things. It's amazing how many hours a day that all of us spend looking at journal articles, you know, public media and other such things, just trying to stay up on what's fiction and what's not. You know, and again, some of my very best advice to this audience tonight is, you know, there's no fault in reading using the internet and social media, but just take your information from trusted sources, because there's an awful lot of misinformation out there, particularly in some of the social media posts that are being spread in terms of causation, in terms of treatment, in terms of the course of the illness. And that's why webinars such as the one we're doing tonight are so important, because you know, the Med Center here has been and continues to be one of the most trusted sources of information. So yeah,
I would comment
to the
that
WHO.
many times that communication goes in the opposite direction, where these national and international organizations contact us.
For
so
sure.
I think we feel good about
Constantly.
that we're in that position.
And last question for this segment, opinions about herd immunity and whether it's time to just open up and let nature take its course and let a significant number of people develop immunity.
Yeah, well, clearly, you know, what we're trying to do is buy time so that we can develop a vaccine and, you know, have herd immunity through vaccination. Clearly, the idea is that if enough people are immune to a illness, it will not spread through a society. Now, this is partly dependent upon how infectious or contagious an illness is. So, for instance, measles, very prototypical respiratory spread, airborne spread virus. You know, you have to have 90 to 95% of your population immune for this virus not to spread in society. And unfortunately, we have seen that when vaccination falls down a little bit, we start to see cases of measles again. Now, nobody really knows what level of immunity we need in society with this COVID-19 agent. I've seen estimates anywhere from about 30 to maybe as high as 60% would be effective in preventing the transmission from person to person, but nobody really knows that. Unfortunately, if we just simply relax all of our precautions, go back to normal, if you will, you know, before we started to have this pandemic, I'm very confident that the epidemic will come roaring back and cause an awful lot of misery and, you know, mortality in our patients and in our society, and that's not the smart way to go. Clearly, what we need to do is continue down the course that we're doing, buy some time. Again, as has already been pointed out, I think we're fairly close to developing some therapeutic agents that will be able to help, and then further down the road, developing that vaccine. But just simply, you know, pulling the stops off, letting everything go back to normal, and let everybody develop herd immunity is going to cause a lot of disruption in many different ways that we just don't want to experience.
You know, Mark, just to use the math that you used earlier, it'd be, I think, illustrative. If we were to go to herd immunity and let's say the 60% number was correct, which is based on the R0, which is probably pretty close to what people are estimating, that means there'd be well north of 200 million Americans who would ultimately be infected. And at 0.5% mortality, that's an awful lot of people who'd be lost in the next 3 to 6 months. And so not to mention the exhaustion of all of our healthcare facilities. Just look at what's happened in other parts of the world, such as Italy and even in New York City. I can tell you it's nothing short of tragic, and that's with some of the most advanced healthcare in the world. So going to a straight herd immunity without carefully watching the prevalence and spread of the disease, and without being extremely cautious about how the non-pharmacologic interventions are lifted, I think also would be a grave mistake.
Well, this is obviously a good segue into the next topic that we want to cover. All of this can weigh heavily on people, children included. So wanted to turn it over to Dr. David Cates, Director of Behavioral Health. Dr. Cates.
Thank you, Paul, and thanks to our family members for making time to join us this evening. I'm going to share some thoughts about coping with COVID-19 stress. Now, the ways in which this pandemic is affecting us obviously depends on our individual circumstances with regard to the communities in which we live, our employment, our finances, our families, our health, and the role that our loved ones are playing in the pandemic response, as well as our individual personalities. But even with these differences, there are some common themes that I think apply to all of us. And first of all, most of us share the basic fear of contracting the illness and spreading it to our loved ones. Secondly, there's the disruption to our normal lives that we're all experiencing in some measure. And a third thing we all have in common is the uncertainty, including how long is this pandemic going to last? And so these fears and uncertainties and disruptions can cause anything from boredom and frustration to sadness, anxiety, and clinical depression. So I'm going to share some tips for coping with COVID-19 stress, and then I'll turn to how to help and communicate with children. So if you are experiencing anxiety, worry, and stress, please recognize that this is normal. In a recent poll, the American Psychiatric Association conducted, 50% of the respondents reported being anxious about contracting COVID-19. And more than a third of them said it was seriously impacting their mental health. 19% said it was affecting their sleep. And just about a quarter of all the respondents were having trouble concentrating due to COVID-19. So the bottom line is, please don't get down on yourself or on members of your family if you are experiencing these symptoms. It's enough to be stressed in the first place. What we don't want to do is layer on top of that stress feeling guilty or concerned or getting into conflict with others about the fact that we're having these feelings. And it may also help to remember that we are, in fact, all in this together, and this will not last forever. So the next tip I have is to limit your media consumption. And I know that this is hard to do. The situation is changing rapidly. It's a gripping story, and it can be hard to pull ourselves away. But we know that too much media causes stress and anxiety, and it can increase our estimation of our personal risk from the virus. And also keep in mind that, news is a business, right? It's designed to grab your attention. So bold headlines and breaking news announcements are all designed to kind of get your eyeballs looking at the news. And it works, but the cost to us is an increase in our stress and anxiety. So I recommend a media diet, something like 20 minutes in the morning, 20 minutes in the afternoon, or it can be a different amount. But the bottom line is not to keep the television on consistently, not to always be checking your phone, and to try to get we do need information. And as Dr. Rupp said, we want to get it from reliable sources. So consider maybe your local health department or one local news station, or maybe one national media outlet, or even the Centers for Disease Control website. Third recommendation is about social support. It's staying connected with the people who matter to you, the people who make you feel good. It's critical to our well-being. A recent study compared the strength. It looked at several leading health indicators and how strongly they were associated with mortality. And what they found was that social disconnection was more strongly associated with mortality than was smoking up to 15 cigarettes a day, obesity, and physical inactivity. Or said in reverse, being socially connected is more strongly associated with longevity, that is living a longer time, than is being physically fit, being at a healthy weight, not smoking, and not drinking. So again, bottom line is reach out to those people who are most important to you, who make you feel good. And this term that we've been using, social distancing, really is unfortunate. What we're doing is physical distancing, and what we should be doing is social connecting. So sheltering in place and social distancing, as we've been doing for weeks on end, is of course a major disruption to our normal routine. So it can be enormously helpful to create and follow some new routines. And ideally, this would include time for work, for hobbies, for exercise, for leisure. And if you're working from home, try to get up and start and stop work at the same times you would if you were going into the office. And in the morning, sort of get up, take off your PJs, take a shower, find a place that's just for work to create that sense of structure. It creates more predictability, which is comforting to all of us, in particular children, which I'll address in just a couple minutes. If you're unsure of how to fill your time, if you're not working, talk with others and surf the net for ideas. There are countless ways you can fill your time, from reading to fixing things around the house, to learning a new language, to checking out virtual museum tours via Google Arts and Culture. So once you start researching and investigating ways to spend your time, there really are countless opportunities for you to fill your time. Okay, next is to spend some time outdoors each day. So there is really good science behind this recommendation. So we've had studies where people are randomly assigned to either spend some time outdoors each day or just go about their business as usual. And what we find is the people who spend some time outdoors each day actually show better cognitive functioning, better attention, better problem solving, and actually better mental health outcomes. Another recommendation, next one, Paul, is keep a gratitude journal. So what am I talking about? We know that people who are resilient, that is, people who respond well to stress, who can rise up to challenges, tend to focus more on positive emotions and experiences than on negative ones, even during challenging times. And gratitude is one such positive emotion. So I recommend every night before you go into bed, just make a note of 3 good things that happened during the day. And they can be the smallest things, like a good meal, or a knowing smile from someone in your family or from a friend, or just a moment of natural beauty, appreciating the colors outside. Or maybe it's just a funny television show that you saw. And we don't usually think of these things as gifts, but that's how we want to think of them, to cultivate this feeling of gratitude. And what we're really doing here is exercising the muscle to notice the good, because we are naturally inclined to notice negative things, to focus in on the stressors and the things that aren't going well. And actually, as I mentioned before with it going outdoors, there's also good science behind this. So people randomly assigned to keep a gratitude journal for just 1 or 2 weeks actually show improved physical and mental health outcomes compared to people who just go about their business as usual. Next is to focus on what you can control. There is so much about this pandemic that we cannot control. And what we want to do is sort of take some control back and focus on those things that we can control, including just our own health. So you can wash your hands, you can follow social distancing guidelines. If you're working, you can focus on that. There might be projects around the house or other kinds of hobbies or creative pursuits that you enjoy. But the idea is, by focusing on things you can control, you are taking control back in a way from the pandemic and all the changes it's caused in your life. And in so doing, you are actually improving your mental health. Follow healthful sleep, eating, and exercise habits. So this is something that you hear a lot. People will say this, but there's a good reason you hear it a lot, and that's because we know that people who do follow these recommendations actually show improved resilience. They adapt to stress better, they manage challenges better. Now, if you're having trouble, for example, exercising each day, or if it's something that's hard to motivate, one thing we suggest is just starting with the smallest thing, maybe just a walk around the block, or maybe even just walking around your house, or even inside your house for just a few minutes. The key is to start small and get some success, because success begets success. You feel good. I did what I set out to do. And then you can add in very small increments, increase the amount of exercise you're doing. With regard to sleep, many of us struggle with that. Insomnia is quite common. There's an app that I would recommend that you download and you use. It's called CBTI, which stands for Cognitive Behavioral Therapy for Insomnia. And it's available for free. It's developed by the Department of Defense. And actually on our website, Nebraska Medicine has the COVID information, the community hub. And within there, there's a section we added called Managing Stress. And you can find information about that app and how to download it in that section. So next is to recognize your own signs of stress and then use them as a prompt or a cue to engage in a positive coping strategy. We all have our individual stress signs. So I tend to group them in 4 buckets. There are physical signs like muscle tension, headaches, and stomach aches. There are emotional signs like our go-to emotion when we get stressed. And everybody knows what that is for you. Do you get irritable? Do you tend to have mood swings? Do you tend to get sort of hopeless or sad? We also have cognitive signs like trouble remembering things, or confusion, or maybe catastrophizing where you imagine things being worse than they are. And then also behavioral signs. So are you someone who tends to get more impulsive and snap at people when you're stressed, or do you tend to pull away and withdraw? So the idea here is to be sensitive to your own signs of stress. And then when you notice them, do one of the things that already works for you. We all have coping strategies that work, whether it's playing with the dog or going for a walk outside or doing a puzzle, listening to music. So often when we're stressed, we sort of lose track of what's going on. We get so caught up in our problems, we don't even realize how stressed we are. And we certainly forget about the positive things we can do about it. So this is really a recommendation to be more mindful of your own cues of stress and then take some positive coping strategy. And the final one, and maybe it's not showing on my screen share here, Paul, but it's okay. It's asking for help. So if you are experiencing ongoing trouble sleeping, or you're keyed up all the time and you just can't calm down day after day, or maybe you're losing interest in things that you normally liked to do, or perhaps you just can't get done what you normally get done in a day because you're so consumed with worry or anxiety or feeling so down. If that's the case, please speak with your healthcare provider and see about maybe a referral to a behavioral health professional. We are here to help. I would also mention that there's the Federal Disaster Distress Helpline. You just want to talk to somebody. It's a confidential, free service available 24/7. And again, there's information and a link to that on the Managing Stress section of our COVID-19 Community Hub, Nebraska Medicine's internet. Okay, so I get a lot of questions about how best to communicate and help children. So I'm going to quickly go through some tips for helping kids. We just talked about recognizing stress and anxiety in ourselves. It's important to do the same for kids, but children may not always mirror how we express stress and anxiety. So preschoolers, for example, may show some regression. That means reverting to behaviors they previously showed, like thumb sucking or bedwetting or temper tantrums. School-age kids may show some of the behaviors that we kind of recognize as being stressed, like being sad or angry, but sometimes they're just more clingy than usual. And adolescents may act out or may be more irritable or isolative. And the bottom line is we need to keep our limits and rules in our families, but often what kids really need is quality time with you. And when you spend that time, some of their concerns may come to the surface. They may tell you about them. It gives you an opportunity to address them and also to dispel any misconceptions they have about what is going on. We talked about limiting media consumption for you, and it's probably even more important for children who may not even understand what's being broadcast. So ideally, any news they watch, you would be there with them, so you can catch any misconceptions they have. You can provide additional context. You can explain things like, the reasons that we stay home is because we don't want to, it's a good thing we're being nice. We don't want to spread our germs to other people. Or if they're talking about people getting sick, you can talk about if we do get sick, there are people here who can help you. But obviously, we're not always there when our kids are watching the news. So why don't you make sure that you're checking in with them? And we'll talk more about that in the next bullet. So we want to create opportunities for children to talk, and we want to encourage them to ask questions. And fundamentally, what do kids want to know? Am I safe? Are you safe? And how does this affect me? And it may help to remind them of times when they were worried or you were worried before, but you got through it. Like, remember that time we had a flood in the basement and some of our things got damaged and we weren't sure how we're going to get all the water out, but we pulled together, we figured it out, and now we're okay. So these kinds of stories create that narrative for kids that, yeah, things happen that are scary, but we can get through them. And when you do provide information to kids, by the way, don't assume that they understand everything you're saying. You probably should ask them, you know, what did you just hear? What did I just say? They can say it back to you, and then you can correct any misunderstandings. Related to this is in these conversations, ask what they know. Ask your child, what do you know about the coronavirus? Or what are you worried about? This way you can correct any misconceptions and you can provide reassurance. And this is something you'll probably need to do on a regular basis as the pandemic continues, because new information comes out, they hear different things, so you want to be checking in periodically. We talked about maintaining routines and structure being important for adults. It's even more important for children. It helps to create a sense of normalcy and a sense of predictability, especially when it comes to meals and bedtime and any special time with you, whether that's going outdoors or playing games or even doing religious practices. And if you're having trouble thinking about ways to keep kids engaged, again, that managing stress section of our community hub on Nebraska Med's internet has all kinds of information. There's in particular a link to a website that itself links to many, many other websites with great ideas, educational ideas for keeping kids engaged, enough to last you as long as this pandemic lasts. Another great idea for kids is to encourage them to take some kind of action to help themselves and others. And this gives them a sense of control over what's going on. For example, you can let them know what they can do around hand washing and social distancing, or maybe even have them wipe down the table so they're taking an active role in killing the germs and making sure everybody stays safe. But they can also help people outside of the home. You have a relative in a nursing home, for example, they can make phone calls to comfort that person, or they can write letters to healthcare providers thanking them, or they can draw pictures for a local nursing home. And what this does is, in the midst of all of this stress and anxiety and things that are not in their control, it gives kids a chance to feel like they are taking action, to take back control and do something that's helpful. Not to mention you are teaching values of kindness and contribution. Make time to be fully present. So you want to create some time each day when you can be fully available to your kids. And this is, of course, a challenge if you're working, so you'll need to be clear about what's work time and when you're available to them. But when you are available, some of that time should be undivided time when you're not also looking at your smartphone, you're not also kind of watching the news or thinking about work or just in your own head with concerns. And during these times, children are likely to feel more comfortable asking questions and expressing their fears, which then creates additional opportunities for you to, again, dispel misconceptions and provide reassurance. So maintaining children's connections to friends and family, this is very much like what we talked about before. Social support is equally important to your kids, and we want to make sure they can connect, obviously virtually, with their friends. And this also goes along with that previous recommendation about creating structure, right? So this is sort of back to that sense of normalcy and predictability. They can still have their play dates, it's just in a different way. So while some regression and acting out, as I mentioned before, is normal in kids, if you're seeing your kid be unduly fearful, sort of unduly stressed or aggressive or depressed, for example, they're having difficulty sleeping for days on end, or they're just not eating for several days on end, or they just seem sad, their mood is low and it keeps going on, do check with their pediatrician, consider referral to a behavioral health professional. And last, but by no means least, and actually perhaps most important, again, I don't see it on my slide, but it's to take care of yourself. We are role models for our children. When we're stressed, they pick up on it. If we are anxious, it's going to make them feel anxious. So probably the single most important thing you can do is to take good care of yourself. And this brings us full circle back to the 10 tips for managing stress in the first place. And with that, I'll turn it back over to Paul to introduce Dr. Richards.
Dr. Richards, I'll just let you take it from here.
All right. Well, hello, everyone. Thanks for joining this evening. I'm just going to spend the next 3 to 5 minutes or so talking about tips for supporting your loved one. So this forum this evening is really all about you. That being said, I realize that many of you on the line are worried about your loved one who is a healthcare worker. And so kind of did my homework for this, reviewed some literature, but then also more importantly, went out and talked to some of my team members, my residents, pharmacists, nurses, and got their input on what was most meaningful to them in terms of what their family and friends were doing to help support them. So giving social support, I think it's really important to recognize that a lot of folks don't necessarily know that they need help. So there may be several reasons why your loved one might avoid social support. So one of those might be that they just don't know what they need. They may be so busy at work, they may be doing a completely different role, they may be doing it in a completely different way. They don't even have time to check in with themselves and reflect on how they're doing. And so they might not even know that they need help. And so that's something to keep in mind in terms of your potentially needing to reach out on a more frequent basis to see if they do need support. Another reason is that they might feel embarrassed or weak. Healthcare workers, by our very nature, are resilient. We've gone through extensive training. We've been in very difficult situations before. We've seen death and dying before. And so we may feel as though we should be able to do this, that we should be able to be the heroes that are that it's being propagated in the media that healthcare workers are a hero. That's maybe not how we feel inside, but we might feel embarrassed or weak and might not necessarily reach out and kind of put over this aura that we have it all together. Another reason that your loved one might not reach out is they just don't want to burden you. Like many people have talked about tonight, like none of us are immune to the stressors of this pandemic. I know that many of my friends and people in the community are under a lot more stress than I am, and I'm going to a hospital each day, but their economic stress or the stress of now becoming teachers to their children and other things like that. You just don't want to burden others when you know that others are burdened to begin with. There's several good ways to give support. I'm just going to run through a few of them. One is to show interest and attention. So one really good way to do this is to find time and space with your loved one where you can make eye contact with them, engage with them, and really listen and be attentive. Sometimes this is difficult with small children running around, so maybe waiting until after they're in bed and just maybe spending 3 to 5 minutes to really connect and ask how your loved one is doing. Also help brainstorm positive ways to deal with reactions. You know your loved one really well. You know what builds them up. I can tell you that my husband definitely chimes in when he says, Sarah, I think you could use a walk with one of your best friends right now, or why don't you call up so-and-so? I know that you always feel better after you do that. So brainstorm with your loved one. You know them best. You know what fills their cup and what can help them when they're stressed. And so help them come up with ideas. Finally, offer to talk as often as needed. I'm here for you anytime that you need. Also, you may need to be more proactive. Your loved one might not reach out. And so thinking about potentially checking in every afternoon via text or phone call or something like that, even if there's no reason to think that something's going on, it's still a good idea to check in frequently. So some simple gestures that can be incredibly meaningful. And this is some of the themes that came up when I was talking to some of my colleagues here at UNMC Nebraska Medicine. So send a text. It's simple. It takes just a few seconds just to check in, just checking in, just wanted to see how you're doing, or simply to say, I love you. It sounds so simple. I know what I've heard. I actually was on a family group text yesterday morning, and my mom chimed in and said, you know what, we need to stop bothering Sarah. She's at work. And I said, absolutely, don't stop bothering me. I need this right now. I need this connection to my family. And so you're never bothering me when I'm at work. If I'm in a patient's room or I'm busy doing something, that text will be waiting for me when I come out, and it'll be that little endorphin surge and that connection that I need to the people that love me. So you're not bothering your loved ones. Little things make a big difference. Tell your loved one that you're proud of them. I've had somebody tell me that they're proud of me, and it was very meaningful, and it was just like a wonderful thing and a wonderful sentiment to hear. And then finally, Ask your healthcare worker or your loved one if they want to talk about their day. There may be days where they do. They need to get it off their chest. They want to talk about what went well during the day or what was difficult. There also might be days where it's been too much. And at the end of the day, what they really need to do is not talk about work and talk about something else. But you don't know until you ask. So just say, would you like to talk about your day? I'd love to hear from you. So with that, I know that it's 7:08. So I think we have about 7 minutes, and I want to make sure you guys have all the opportunity to answer your questions.
Thank you both very much. We do have some other questions. We do have one that was submitted ahead of time, and we have leaders from our human resources departments from both UNMC and Nebraska Medicine on the line. And these questions might best be answered by Aline or Frank. So when might essential staffing end for UNMC, and when would Nebraska Medicine designate essential staff? Frank,
So,
Aline, are you able
Why
to?
don't I take the first one because President Carter and the chancellors issued a statement earlier today saying that we were going to maintain our current status of essential employees only on all of the academic campuses through May 4th, with an understanding that as we get towards the middle or end of next week, we're going to reassess the number of active cases, healthcare utilization, et cetera, on the various campuses and locations across the state of Nebraska, and then make a determination as to how and if and when we're going to return to the next stage of near normalcy. Obviously, it's going to be a new normal kind of environment. We're optimistic that we can make some changes by May 4th, but again, it's going to be data-driven.
and as far as Nebraska Medicine goes, and good evening, everybody. My name is Frank Venuta. I'm the Chief Human Capital Officer. And before I respond, I just want to thank all the families that are on the line. And most importantly, is to thank all of you for supporting our colleagues. Your support is critical and important, as Sarah explained to us. And it allows us to take care of our community, and it allows us to do the work that we love to do and the work that we feel honored to do for our community. In regard to essential staffing, we like to look at it this way at Nebraska Medicine, that all of us are truly essential staffing. The question is whether you're working on the campus or working off the campus, as already we have a significant portion of our workforce that are working from home. We would very similar to Dr. Gold, as Dr. Gold said, we'll take consideration as to what's happening with the COVID and what our staffing needs are. And if we get to the point where we actually need all hands on deck, then we'll call in essential staffing, and through our leaders, we'll make sure staff knows specifically whether they need to come directly back to the campus for supporting our workforce. But until then, we're operating quite well right now with a significant percentage on the campus and a significant percentage working from home.
So this was a question submitted ahead of time, and I think there are probably elements of it that every single member of our panel here could speak to. I'll read the question for everybody. When social distancing is relaxed, I'm concerned I will be required to go back into an office where working from home is working just fine and protects my family and older vulnerable family members. Will there still be possibilities of working from home until a vaccine is available?
Sure.
I'll start, if that's okay. Well,
Sure.
Frank, go ahead.
Right now, as we consider, and as Dr. Linder explained, we're looking at reopening, and part of that reopening plan will be what considerations will we have in terms of bringing staff back to the campus. Right now, working from home is working very well. At this point, I don't see any reason to change that until we get further down the road in understanding how much further COVID behaves, and whether it's necessary to bring folks back onto the campus. Our safety of our patients and the safety of our colleagues is our foremost concern. That is our #1 priority in our organization. So will the possibility be to continue? Of course. In fact, we continue to encourage it. Dr. Gold?
I would say ditto.
From a staffing perspective, are we prepared if there were a dramatic surge in cases in our area? Would we mandate overtime? Would we have enough people to do the job needed to do?
Yeah, I would say certainly right now we're in a position where we have surplus staffing, so we can take a significant capacity increase right now. Of course, we'll do whatever we need to do in order to take care of our patients. We have a very loyal and dutiful workforce. They understand their obligations, as Dr. Rupp explained earlier. This is a profession and an obligation, and most folks step up and volunteer, and that's the way we'll go first. If we get backed into a corner and a push comes to shove situation, we may ask and mandate some overtime. But in the time I've been here in the 5 years, that's never been necessary. Our staff has always stepped up to the task.
As we approached the possibility of a surge, we actually took the configuration of our workforce and built teams so that it could actually deliver more per person than they could alone.
Yeah, I would just say never, you know. So I guess I get to make a few closing remarks. Is that right?
It's all yours.
Well, you know, first of all, I'd like to thank everybody. We had well over 450 participants in this webinar tonight, which is amazing. Certainly kudos to Sarah and David for their good advice. I hope to be able to follow much of it myself. I'll see how that goes. But I thought I would just take a minute and read to you from one of the many letters that was just addressed to the Med Center. And I don't know if you can see this. It's illustrated by a fourth grader. And it says, "Dear doctors and nurses at the Med Center." It is printed in pencil, I might point out. It says, "Thank you so much for helping during these rough times. You guys and gals are America's heroes right now. I hope that you're doing good as well. Keep up the super duper amazing work. Much love." And then it's signed a fourth grader. And I would just echo these comments. Much love and thank you.
Thank you. We're all very fortunate to be working with you in this community. It's just a wonderful place to live and work. Thank you very much.